Hi everyone, welcome to researchmd.com. Today our clinical question is can we use Ayurvedic medicine for the treatment of COVID-19? My name is Pramil, Cheriyath, the Program Director, Internal Medicine Residency, Transitional Residency. I teach medical students and residents on a regular basis. I'm also Director of Research. So let's get into our topic. What is Ayurveda? Indian method, I would say, was several centuries, one of the oldest systems. It was practiced known as Ayurveda. There's a lot of ancient books on it. Usually you can call it a natural or a holistic approach. And the medicines usually come from the plants, and there's a diet, exercise, and lifestyle, and those are the things. And several studies have shown in benefits in so many other diseases and all that too. So we did some literature search, and we find this study like a randomized placebo-controlled study looking at the efficacy of Ayurvedic treatment regime on COVID-19 patients. So objective or hypothesis to evaluate the impact of traditional Indian Ayurvedic treatment regime for asymptomatic patient with the COVID-19. So let's look at the study. This is a randomized double-blind pilot clinical trial. So just anytime when you use the randomized double-blind, the strength of the study is extremely high. Okay, what did they use? They used this Ayurvedic drug called Giloy Ganvati, which belongs to Tinospora cordifolia, and Swasari ras, and they're given orally. These are the medication they use. These are the Ayurvedic treatment they use. They also use Tulsi Ganvati, and given orally to the patient in the treatment group twice per day for 7 days. They were also given Untitled traditional nasal drop also. Okay, so they were treated twice per day for 7 days, also given the nasal drop, and the treatment group witnessed 100% recovery by day 7, while it was 60% in the placebo group. So they compared the placebo group. The recovery rate is almost 100% by day 7 in the treatment group, which they use Ayurvedic medications. Okay. Now, so based on this study, what are the results? Odds ratio for reduction time to recovery in the treatment group was 0.41 with the p-value 0.04. And when you compare for treatment for 3 and 7 days, so significant improvement in the symptoms by day 3 and day 7. 40% absolute reduction in the treatment of delayed recovery from infection in the treatment group. So another nice table explaining relative risk reduction in the odds ratio in the treatment group when you compare to the other group. So based on this randomized controlled clinical study, we can clearly say that there's some benefit, can expedite virological clearance, help in faster recovery, can come in and reduce the risk of viral dissemination if you use Ayurvedic treatment when you compare to the other things. Okay, thank you so much for watching. We'll be back with another presentation soon. Thank you.